Man, my heart breaks for this poor girl who made a decision at the time that was right for her, but now in her current life regrets it. And I find this discussion about the risk of regret with a tubal really difficult to have because we know that the majority of people who get their tubes tied won't regret it, but there is a small percentage who do. And for those people, this can be a really sad thing that they've gone through. If you're considering having your tubes tied, I really encourage you to ask your surgeon specifically how they plan to do the surgery. Really, they should be telling you that, but just so you understand, there are multiple different ways that we can technically sterilize you. Previously, there were a lot more options with like Filshie clips or rings, or we could remove just a portion. Nowadays, the majority of us actually remove the entire fallopian tube. And while you should consider all of these permanent and non-reversible, technically some of them are reversible in the sense that we can remove the clip and sew your fallopian tubes back together. This isn't an option for all things though. So for this patient, she had a bilateral self-injectomy. She had her entire fallopian tube removed. So there's nothing that you can even put back together with a tubal reanastomosis. I explain this in great detail to my patients about how we're going to remove the entire fallopian tube, and if they ever were to regret this, that they could not have a tubal reanastomosis. Instead, they would have to go through IVF, which typically costs about $15,000 out of pocket at a minimum to be able to have a biological child.